Now we're going to continue on with more information about depression. Now it's important to know that depression is actually linked to pain and sleep. We know that depression can exacerbate chronic pain. About 50% of people with chronic pain actually have depressive symptoms. 50%. We also know that depression is associated with sleep disorders. About 20% of people with any kind of sleep apnea or sleep disorder actually are going to experience depression as well. Both are associated with a lower physical activity and less weight loss when attempted. And by both, we mean people with chronic pain and sleep disorders. So what we know then is that the relationship between depression, pain, and sleep is actually bidirectional. We also know that lifestyle changes can have a big impact on depression, pain, and sleep. So as a health coach, it's really important for us that to be able to ensure our clients through referrals. So if we see that our client has experienced any of these things, we can refer them out. We need to also be able to help our clients adhere to self-management instructions, as well as keeping track of follow-up visits. Depression and other mental health issues exist, so having a chronic mental health illness can actually trigger depression. So oftentimes, that mental health component is not standalone, and that it might also trigger other things like anxiety and depression. And depression frequently coincides with the following: alcohol use disorder, drug use disorder, anxiety, personality disorder, and binge eating. So when we think about mental health components that are often associated with depression, we're thinking about alcohol use, drug use, anxiety, personality disorders, as well as binge eating or any kind of disordered eating. Now, it's also important for us to be able to identify depression. So like I mentioned earlier, it's outside of our scope as a health coach to diagnose and treat depression. However, we should be able to take and use mental health history as part of that initial assessment. We need to be able to understand our client's experiences and challenges. That's important. We also need to be able to build the client's relationship, the coach and client relationship, and enable the coach to help connect the client with professional treatment if needed. So I know I'm going to mention this again, but always important that if you are going to include some sort of depression scale in your paperwork that you have your clients complete in the very beginning when working with you, it's important that you have that discussion with them ahead of time to make sure that that's something that they're comfortable and willing to do. And the reason why is that there tends to be a stigma surrounding the psychological disorders, and it may make some of your clients feel reluctant to actually work with you as a health coach. So rather than just including it in your paperwork and not saying anything, always have that discussion in that initial meeting with them so that they know they're prepared for it, and also so that they know why they're doing what they're doing. So there's actually a screening tool that I want you all to know that exists to add to your toolbox. So if you suspect that your client might be experiencing depression, you can actually, and they don't have maybe a previous diagnosis, you can use this, it's a really brief screener so that you can see if you need to refer out and have your client seek further treatment. It's actually known as the PHQ. But again, make sure that you discuss with your client, make sure that they're comfortable with this before you move forward with this. So as you can see in the PHQ, it's only 9 questions. They rank it on a Likert scale of 0, not at all, so they don't agree with that at all, 2, 3, nearly every day. That happens every day to them. And really what you do is you score this, you get a total sum, and you can see that on the bottom right, and a score that's 5 or greater is going to indicate possible depression. So if that is something that you do with your client and they score 5 or greater, that would be a point where it's a good idea to refer your client out to a person who specializes in mental health. So let's pause here and do a learning recap. First question is, what % of people with chronic pain have depressive symptoms? The second question is, depression often coincides with other mental health issues. What are those health issues? We'll pause here and I'll see you for the next lecture.